Welcome back. When you think about Movember, you probably think about guys finally getting their chance to grow out their nice Tom Selleck mustado, but there's a lot more to it than just that. Movember is also about men's health. Joining us today, we're going to talk about what we're doing for men in our community. We got Jill and Kayla with Apex Physical Therapy and Wellness Center. Ladies, welcome to the show. It's great to have you.
Good morning.
Thank you.
So some of the things you guys do over there is with men's pelvic health, and whoever wants to start with this one, go ahead, but just talk about what you're doing with that and what is that, how does that help men, and what are you seeing?
Right, so we treat a lot of different male pelvic floor conditions. One of the most common we see is going to be pelvic pain in males. Unfortunately, a lot of the male patients that I see come to me thinking they're the only one in the world who has this issue, where actually we found up to 20% of men will experience pelvic pain at some point in their life. I mean, that's really a lot. That's 1 in 5. So it really is a pretty common condition that we will treat.
We also see a lot of patients either before or after prostatectomy surgery, and along with treating incontinence, which tends to be a common symptom after that procedure.
Yeah, so how does the physical therapy help men with the pelvic pain or the incontinence, or what kind of things are you guys doing for them?
Right, so in regards to pelvic pain, the muscles are what we call overactive, which really just means they're tight, they're tense, they don't know how to relax these muscles. So the pelvic floor muscles are muscles just like anywhere else in the body. When they become tense and tight, they cause pain. So as physical therapists, we really feel like we're the best ones to treat muscle issues. So when the muscles are tense or tight, we'll use a lot of manual therapy, hands-on treatment to get them to relax, specific guided exercises which may include a lot of stretching. We'll use biofeedback, and we can actually even use dry needling to help these muscles relax. Really, our goal is to decrease this tension, decrease pain, so men can return to the activities they like doing. On the other side, with incontinence or bladder leakage, these muscles are what we call underactive, which means they're weak. So in this case, we'll take through guided strengthening exercises, both of the pelvic floor, but also the surrounding muscles. We also want to teach the pelvic floor muscles to work correctly with different movements. This will help reduce incontinence and, again, get these men back to the activities that they really enjoy doing.
So why do you think 1 in 5 men, it may even be higher than that, but like 1 in 5 men based on your data are having these pelvic issues? What, are we not stretching enough? What are we doing wrong?
That definitely could be. We're not stretching enough. A lot of times maybe we have some underlying injury or maybe a prostate or a bladder infection. These muscles will guard against some of these injuries or infections, and over time, that muscle guarding and tension can result in pain.
Man, good stuff. And I want to give you the last word as well. Anything else you want to add to this conversation, or how people can reach out to you and what guys can be doing to make a difference?
Yeah, absolutely. Unfortunately, in this area, this tends to be an underserved population, especially in regards to men's health or pelvic health. So we're proud at Apex to have several highly qualified and trained therapists to help treat this population. Men's health tends to be a pretty sensitive topic, so our patients can know that they're receiving the highest quality care at our facility. So feel free, everyone can visit our website, apexptwellness.com. Give us a call at 701-364-2739, or also check out our Facebook page to see what we're up to.
I got 30 seconds left, and you said something I think that is really interesting. You said, hey, men's health can be a very sensitive conversation. What do you mean by that, and how do we sort of bridge that gap and make it easier to talk about?
Yeah, absolutely. So I feel like there's a lot of men and women that are dealing with a lot of these conditions. And unfortunately, living in the Midwest too, we tend to be a little bit behind the times. We tend to be a little bit more conservative about talking about these topics. So if you or a loved one are having any of these symptoms, try to open up that conversation. Or when you're in to see your primary care provider, let them know that you're having these symptoms. You don't need to see your primary care provider. We have direct access, so you can come see us right away as well. But just don't be afraid to open up that conversation, because there's definitely things that we can do to get you feeling better. Don't feel like you have to suffer with all of these symptoms.
Amen to that. Thank you so much, you guys. Great conversation. I really appreciate it.
Yeah,
Thank you.
Thank you. All right, stick around. We got a lot more coming up right after this.